Good afternoon, everyone. So I am Dr. Amit Sharma, medical oncologist from HCG Cuttack. So my topic which was given to me is the role of targeted therapy or newer therapies in the management of cancer. So first of all, what is targeted therapy and why it is called targeted therapy? So literally it means you want to hit a target only. You don't want to cause for any generalized side effects. As initially when we developed the drug regimens for cancer management, we used to use chemotherapy. So chemotherapy was basically we can say a generalized poison which not only kill the cancer cells but also have a lot of side effects to our general body cells. So later on we slowly developed our regimens, and now we are moving towards the what we can say is targeted therapy. So targeted therapy literally means that it only hits the cancer cells and it doesn't affect the general body cells, so that it won't have so many side effects which you may have heard for chemotherapy, like loss of hairs, loss of appetite, and tiredness, vomiting, and all that side effects which you must have heard from previously regarding chemotherapy side effects. So basically what we want to do with the targeted therapy is we just want to target the tumor cells, and we want to spare our normal body cells, so that we won't have those sort of side effects. So targeted therapy can be in multiple ways. Targeted therapy we generally use against the cancer cells when to stop their blood vessel formation, like we inhibit the angiogenesis by using angiogenesis inhibitors. A lot of regimens are there, a lot of drugs are there which are VEGF inhibitors, like bevacizumab, ramucirumab. This one was the earliest one of the targeted therapy which we started to use, and they have very good effects, especially in most of the tumors actually. And thereafter now we move on, and now we have spectrum of targeted therapies, including even the tablet forms. They are available in the tablet forms in the lung cancer, and those tablets are extremely effective, very less side effects, and some of my patients on those tablets are living from almost 4 to 5 years. So this is something which we can achieve even in the tablet forms. Now you must have heard the newest form of targeted therapy, that is the immunotherapy. In immunotherapy we use our own immune cells to fight against the cancer cells by targeting those specific receptors which help the cancer cells to escape our immune system. So these are the newest type of drugs, immunotherapy, which are very much available right now from last 1 decade, and now they have roles in almost every single kind of a cancer. And again, the survival rates are increased in a great way. I mean, those people even initially in the advanced stage for lung cancer who used to have say 6 to 7 months survival after chemotherapy, now we are approaching somewhere around 36 months or maybe 3 years, 5 years survivals for those patients, and we are ongoing in that case. So this is something which magical happened because of this targeted therapy in immunotherapy in the recent years. So this is something which I wanted to tell you, just to in brief. The targets and all this is very complicated pathology which is very difficult to understand, but these drugs are working very nicely, and they are very effective with very little side effects, and only targeting the cancer cells and escaping our rest of the general body cells. So less side effects, great survival for the cancer cells. Thank you so much for patiently listening to me.